What can I get you?
Phase 2 of reopening after months of staying home and eating inside at restaurants and going to the gym are now options once again. But state leaders caution COVID-19 is still here.
It's a little stressful because we have to take care of so much now here with more sanitizing, more disinfecting to make sure we're keeping our customers safe as well as our employees.
So my concern is that people see the data and they think that we're back to normal, but we're not.
Now, speaking of that data, Connecticut is one of the top 5 states in the country when it comes to the number of declining cases, the lower percentage of positive tests, and having ample hospital space. That's according to a recent study. But there are places like Arizona, Georgia, the Carolina, Florida, so many states seeing major spikes in cases now. So how do we stop that from happening here in Connecticut? Joining me now on Face the Facts is Linda Nicolai. She is the director of Connecticut's Emerging Infections Program at Yale University. Ms. Nicolai, thanks for joining us.
Thank you for having me.
So what have we learned about the virus most recently? Because this is a novel virus, the guidance from the CDC seems to change weekly, like how long it lives on a surface or how long it's airborne. What have we learned?
Well, you're right. The guidance does change frequently, which can be unsettling. But I think that that's a positive thing. It reflects that we're learning more and more about the virus. This pandemic, this novel virus came to us so quickly. And because of its novelty, we knew very little about it. So certainly, many of our brightest scientists are working very, very hard to learn more about things like transmission and survival on surfaces. So I think we should really be welcoming new guidance as it comes out because it's reflecting the latest, best evidence that we have.
What is your opinion on vaccine research or even therapy research? Some companies say that they have previous research on things like SARS, and that gave them a head start when it comes to finding a vaccine for COVID-19. Do you believe that's true, and where are we on that?
So I think a vaccine, I have a lot of confidence that we will one day have a vaccine. I think the thing that we don't all agree on is how quickly that can happen. It's incredibly complex to develop vaccines. I mean, there is the developing the vaccine candidate, and we've made really good progress on the vaccine candidates. But once we have a candidate, we need to test it in humans. And these studies take time and they take people. And, it's going to be really, really important that any vaccine that gets licensed and recommended for use in the general public, that it be extensively tested for safety. And again, these studies take time. So I'm optimistic, very optimistic that we'll have a vaccine, but we need to make sure that that process is not rushed such that, we're sorry down the line. We need to make sure it's safe first and foremost.
A while back, Dr. Anthony Fauci talked about remdesivir, and that was going to be a good therapy, and he thought it would definitely shorten the stay in the hospitals. But we haven't heard much in a while. Do you believe it's still being used, or have you heard any research updated on that?
Yeah, no, actually, that's a good question, and one that I don't have a good answer to. But again, I have tremendous faith and confidence in our public health officials, in the academic, scientific communities, and in the pharmaceutical companies. There's just been such a full court press on this that I do believe that the data are coming. It's been a very difficult time for those of us working, trying to make good judgment and good recommendations and have sound guidance in the absence of all the evidence we need. But work on that is continuing, and so stay tuned.
And I can only imagine that your family and friends are texting you and asking you questions on a regular basis as well. Look, we heard this week that the governor's task force said we need to stay the course with the masks and the social distancing, even though they're letting larger groups gather. Are the states that are seeing a surge now, and we believe more than half of the country is actually seeing it, are they not heeding the warnings? What are we learning about why we're seeing spikes elsewhere?
Yeah, I think it is absolutely that people are not heeding the warnings. You can, go out into your own neighborhood or you can watch the news. And I think, Florida is an interesting example of a place where they were not hit that hard early on in the pandemic. And I think there's been some amount of complacency. And so now Florida is one of those states that's seeing a very large increase. I think what happens is, when people feel like it's not an immediate threat, it becomes easy to become complacent and to let down our guard. And then it's only when it does feel to be more of an immediate threat that we might change our behaviors. But by then it's too late. When we feel like we're in imminent danger, transmission is already happening. It's really important to note what we have today to prevent transmission, ongoing transmission and resurgences is personal behaviors. We don't have a vaccine, as discussed. We don't have preventive treatments. What we have is this collective ability for us to together come together and decide we need to be following public health guidance, social distancing, mask wearing, and hand hygiene. And that's really what we have. Our capacity to test people has improved a lot. So increased testing from what we saw, weeks and months ago has really been a positive turn. But testing alone is not prevention. What is prevention is social distancing, mask wearing, and hand hygiene. And so the increased testing has been, again, a very welcome thing. What follows from testing is contact tracing, which is another tool that we have, again, without a vaccine, without preventive treatment. We have testing and tracing, contact tracing, but what underpins all of that is the behaviors we need to be engaging in. Now, in Connecticut, Connecticut was hit very hard early on, as everybody in the state knows. We've done a great job, I think a really great job of bringing down transmission. As you mentioned, cases are down, hospitalizations are down, and deaths are down. So now is the time to remain vigilant around these personal behaviors to keep transmission low. We all want to get back to work. We all want schools to open in the fall. We all want to see our friends again. And that's only going to be possible in the coming weeks and months if we commit to following public health guidance around preventing transmission.
I have about 20 seconds left. How do you think we're doing when it comes to tracing? There were some problems with the software to try to tabulate things in the beginning.
Yeah, those are being worked out. It's a huge undertaking to implement contact tracing statewide. So we can always expect there to be bugs in that. But what the software has done has now really, the software system has created the infrastructure. It is a platform on which contact tracing can be ramped up. So in the coming weeks and months, as that system continues to roll out, what we really need now, similar to the behaviors I talked about, is we really need residents of the state of Connecticut to cooperate and participate in contact tracing. If you get a phone call, a text, or an email, be responsive, listen to the guidance, engage in those behaviors, and we can really keep transmission down.
Linda Nicolai, Director of Connecticut's Emerging Infections Program at Yale, thanks so much for joining us on Face the Facts. We hope you stay safe.
Thank you. You too.
Still ahead on Face the Facts, were you brave enough to head to the gym this week? We're going to hear